Hi, my name is Clara DeWald, and I'm in Dr. Story's pharmacology class at Augusta Technical College. I did my pharmacology project on Class 1 antiarrhythmics. Class 1 antiarrhythmics, they block fast voltage-gated sodium channels in the cell membrane during an action potential, and they slow cardiac conduction velocity. These are split into three subclasses. Class 1A has disopyramide, procainamide, and quinidine. Class 1B has lidocaine, mexellatine, and Class 1C includes flecainide and propafenone. The actions of these three subclasses differ a little bit, but Class 1A is they're moderate sodium channel blockers, and they depress phase 0 of the action potential, and they prolong the duration of the action potential. They have some potassium blocking effects, resulting in an increased QT interval, and they slow the impulse conduction in the atria, ventricles, and His-Purkinje bundle branches, and they delay repolarization. Class 1B have a mild degree of sodium channel blockage. They depress phase 0 somewhat and shorten the duration of the action potential, resulting in a shortened QT interval. They decrease electrical conduction, decrease automaticity, increase rate of repolarization in the atria, ventricles, and His-Purkinje bundle branches. Class 1C has a marked degree of sodium blockage. They markedly depress phase 0, resulting in extreme slowing of the conduction with little effect on the duration of the action potential and no effect on the QT interval. They decrease conduction velocity in the atria, ventricles, and His-Purkinje bundle branches, and they delay ventricular repolarization. All of these drugs are rapidly absorbed through the gastrointestinal tract if they're taken by oral route. They're all widely distributed after oral, intramuscular, or intravenous routes. They undergo extensive hepatic metabolism, and they are excreted by the kidneys via the urine. They cross the placenta and enter the breast milk, and they are water soluble. The general indication for usage is that they're all used to treat life-threatening ventricular arrhythmias. Class 1A is used for long-term suppression of supraventricular tachycardia and ventricular tachycardias, atrial flutter, and atrial fibrillation. Class 1B is used for short-term use only for ventricular dysrhythmias. Class 1C, treatment of supraventricular tachycardia, life-threatening ventricular arrhythmias in adults, prevention of paroxysmal atrial tachycardia in symptomatic patients with no structural heart defects. So these drugs are contraindicated in the presence of an allergy to any of these drugs, bradycardia, heart blocks unless an artificial pacemaker is in place, heart failure, hypotension, shock, electrolyte imbalances, and pregnancy and lactation. They can only be used in pregnancy if the benefit to the mother outweighs the potential risk to the fetus. And because it does enter the breast milk, an alternative method for feeding the baby must be found. Caution must be used in patients with hepatic and renal impairments. Procainamide is contraindicated in atypical ventricular tachycardia and systemic lupus erythematosus. Lidocaine is contraindicated in patients with Stokes-Adams syndrome and Wolff-Parkinson's White syndrome. Propafenone needs to be used cautiously in older adult patients and in patients with chronic respiratory disorders. Adverse effects include dizziness, drowsiness, fatigue, twitching, mouth numbness, slurred speech, vision changes, tremors, and possibly convulsions, changes in taste, nausea, and vomiting, proarrhythmic effects, which could possibly lead to arrhythmias, hypotension, vasodilation, and risk for cardiac arrest. Respiratory depression can lead to respiratory arrest. Also, rash, hypersensitivity reactions, loss of hair, and bone marrow depression can occur. There's a few drug-drug interactions that can happen. So there's an increased risk of arrhythmias if any of these are taken with other pro-arrhythmic drugs such as beta blockers or digoxin. If quinidine is taken with digoxin, it can lead to an increased digoxin level and toxicity. Monitor digoxin levels and make dosage adjustments. Serum levels and toxicity of Class 1A drugs increases if they're taken with cimetidine, and risk for bleeding increases if these are taken with oral anticoagulants. Possible drug-food interactions that can occur. So you need to avoid foods that could alkalinize the urine, such as citrus, vegetables, and milk. And patients taking quinidine and propafenone need to avoid grapefruit juice. It's important to educate the patient on the medication that is prescribed, the name, the dosage, frequency, adverse effects, and warning signs that require immediate attention. Also, it's important to teach the patient about any monitoring that needs to happen, any labs, diagnostic testing. Educate the patient on avoiding grapefruit juice if they're taking quinidine and propafenone. Educate the patient on avoiding foods that could alkalinize the urine. Also, avoid taking antacids because that has the same effect. Educate the patient on the importance of avoiding over-the-counter medications that could cause interactions, and communicating any new prescription medications to avoid interactions. If you're taking propafenone, you need to take your medication with food. If GI upset does occur with any of these drugs, the medication can be taken with food, and small frequent meals can help alleviate any nausea. Thank you so much for watching my video.